We all know the importance of training and keeping up to date with the latest information and learning. All of you know the importance of training and keeping up to date with the latest information and learning. As we move towards the implementation of CIS, it is important that we become comfortable with the system. Ultimately, this system will make our jobs easier and benefit the patient through easier access to their files. Web-based training are beneficial to become familiar with the Cerner screens and the look and feel before instructor-led training. Every user will be invited to a web-based training lab for 4 hours. Cerner instructor-led training is functionality-based and helps you with the skills appropriate to your role. Practice is the most important element of the training. Hands-on practice will give users the confidence to use the system and to understand appropriate documentation. To be considered complete, every user will take a performance-based competency to demonstrate the understanding of how to use the system. Super users will be the lead for helping end users to complete practice activities and check off on each end user competency. Super user compliance to the end user schedule is critical for end users to be validated. Super users and end users passports are the key to remembering the training activities before go live. Once you have completed all activities in your passport, you have completed the required training. The web-based trainings are the best way to refresh your memory before go live. If you are trained a while before the go live date, you might forget some of the steps. Gain confidence by retaking the web-based training at your leisure.
We're about to move into a really exciting phase of the development of clinical care at Hamad General, which is the implementation of the Cerner clinical record. So we're moving away from paper records to an electronic patient record. And your input into that record is really, really important. So we need you to attend the electronic web-based training and work alongside super users. And those super users will be like your driving instructor. You may have to do some tasks that you maybe only do 1 on every 100 patients. They will help you find the right place in the chart to chart the patient's status and the patient's education as you go along. So I hope you'll find this change really exciting at Hamad General. It will be determined by how successful and how motivated you are by that training and by attending and working alongside our colleagues in informatics. So I hope you will fully get engaged so that we have one of the most successful go lives within HMC.